Remember,
This conference will now be recorded.
just always remember that the minor salivary glands are the most malignant of the salivary glands. 90% of the minor salivary glands are benign, whereas 90% of the major salivary glands, that is parotid, submandibular, or sublingual, 90% of them are benign. Classifying the salivary gland based on the secretion, there are pure serous, pure mucinous, and mixed. Sublingual and submandibular glands are of mixed type of secretory glands, whereas parotid is a pure serous, whereas glands of Baldwin and Dunn are mucus type of secretions. So always remember, mixed salivary glands are submandibular and sublingual, whereas serous is the parotid. Based on the ductal system, they are simple and compound. So as I have showed in the first or second slide, so here again there are simple types and compound types. So the simple types are the minor salivary glands, and the compound are the major salivary glands. As the gland is larger in size, the architecture is more complex. So just remember it like that. Major has a compound ductal system, whereas simple has a just straightforward single ductal system. Coming to embryology, so the salivary glands are formed due to proliferation of the oral epithelial cells. This forms a focal thickening that grows into an underlying ectomesenchyme. So this follows a pattern called as branching morphogenesis. What happens is your continued growth pattern results in formation of small bud connected to the surface. So this branching morphogenesis is a successive steps. So it keeps on branching. The steps keeps on happening. So this produces successive generations of buds and hierarchical ramification of the gland. So here it is mentioned that branching morphogenesis defined as a growth and branching of epithelial tubules during embryogenesis. This is the fundamental feature of any gland, like renal, lung, mammary gland, submandibular gland, or pancreatic morphogenesis in mammals. So whenever you come across a question with any glandular embryology, always remember to keep a subheading or a highlight point called branching morphogenesis. So this is the pattern with which it develops. First, a solid downgrowth happens from the epithelium, which keeps branching out. So after the downgrowth is branched, canalization of the duct happens. From that canalization, acini or terminal parts of the ducts are developed. Coming to parotid gland, it is developed from the corner of the stomodium, that is in the intrauterine life of 6th week. The submandibular gland forms from the floor of the mouth. It also develops at the end of the 6th week, whereas sublingual and minor salivary glands develop later. The sublingual glands develop from the submandibular primordium, while the minor salivary glands formed from the buccal epithelium. So as minor salivary glands are always present at the base of the tongue or the cheek or the palate, they always form from the buccal epithelium. So while going in deep into the microstructure of the glands, they are called as the functional unit is called as the secretory units, that are the acini. So they have serous cells and mucinous cells, mucus cells. So they are also called as serous acini and mucus acini. This is how a microstructure of the gland resemble. So whatever is produced from these cells gets communicated into the lumen of these branches. They in turn end into the main duct. So this is a myoepithelial cell showing the basal lamina and the secretory cells. I'm not going in detail about these cells and their origins, etc. Just keep in mind the different types of cells that you can come across in a salivary gland, that are secretory cells and myoepithelial cells. So in an order of descent, first is the acini. So this is a mixed acini from which intercalated they drain into the intercalated ducts. Then they drain into the striated ducts. They drain into the excretory ducts. Here, as an example, they have given us Stenson's or Wharton's ducts. So at the end point, this is the excretory duct. So coming to the gland in proper. So the first one and most asked question is about the parotid gland. So this is the largest salivary gland, which weighs about 15 grams, and it resembles a pyramid. Always remember the apex is always directed downwards in the parotid gland. So parotid has a capsule, as does the submandibular gland. So it is a continuation of the investing layer of the deep cervical fascia. So always remember, after passing the sternocleidomastoid, the investing layer of deep cervical fascia splits into two: the superficial lamina and the deep lamina. So here you can see this is the superficial lamina, this is the deep lamina. The superficial lamina gets attached to the zygomatic arch, while as the deep lamina, after encircling the gland totally, gets attached to the styloid process and small other places like the body of ramus and tympanic plate, but always remember, attach it to the styloid process. Coming to relations, the superior surface has the related to the external acoustic meatus, posterior aspect of the temporomandibular joint, and superficial temporal vessels. This is the superior surface of the parotid gland, whereas the apex always overlaps the posterior belly of digastric. So here example, so this is the superior surface near the zygomatic arch. This is the superior surface, this is the apex, whereas this is the superficial surface. So anything under the skin is the superficial surface. So it is covered by skin, superficial fascia, and superficial parotid lymph nodes. And comes the superficial layer of the investing layer of deep cervical fascia. And the anteromedial surface is formed by the posterior border of ramus of mandible. So these are related to the muscles of mastication and pterygoid muscles, that are masseter, and lateral surface of temporotibial joint, and medial pterygoid muscles. From the posterior medial surface, here is the posterior medial surface. It lies the sternomastoid and styloid process with the structures attached to the styloid process and external carotid artery. These are the surface relations to the posterior medial surface. This is a cross-sectional view. So this is the superficial border, carotid gland, and this is the medial border. So there are certain arteries which are very important in relation to parotid glands. Those are the external carotid artery, maxillary artery, superficial temporal vessels, and posterior auricular artery. So they pass the external carotid artery pass through the parotid and gives various branches. They end into posterior auricular, superficial temporal, transfacial, maxillary artery in relation to the parotid gland. Coming to the vein, the important veins which are divided in relation to the parotid are the maxillary, facial, and retromandibular. Always the veins go in hand with the arteries. Coming to the nerves which pass in the parotid gland, there are 5 branches which are very important. Or the temporal branch, zygomatic branch, upper buccal branch, lower buccal branch, marginal mandibular, and cervical branch. So this might have been discussed in numerous times in your anatomy in your first year. So this is in Pattis fasciavenous plane. This is important to operating general surgeon because that plane differentiate between the superficial part and the deep part of the parotid. So in this plane, the isthmus is present. So whenever you're doing a superficial parotidectomy, you don't need to cross the Pattis fasciavenous plane. But while you're doing a total parotidectomy, you should be very careful in dissecting the Pattis fasciavenous plane and access the deep part of the parotid. So coming to the parotid duct or the Stenson's duct, it is about 5 centimeters long. Can anyone say where does it end? Where does the Stenson's
inside of second molar?
Inside of second molar or
Second molar.
second or first?
First. Second molar.
Are you sure? ఒకళ్ళు సెకండ్ అంటున్నారు ఒకళ్ళు ఫస్ట్ అంటున్నారు. Second molar is the correct one. It opens at the upper second molar. Again, there are a few relations to the traversing course of the parotid duct, which are not that important unless you are operating a patient. So here it shows the opening of the Stenson's duct at upper second molar. So this is surface anatomy of the parotid duct, which corresponds to the lower border of the tragus. Here it is this is the tragal point. Lower border of the tragus to the point midway between the nasal ala and the upper labial margin. So if there is an imaginary line drawn from this position to the tragal point, so this is the most common site where the Stenson's duct is present. So arterial supply, it is external carotid artery, and venous drainage is through the external and the internal jugular vein. Always remember, whenever a gland is present, they might give you a in the parotid. I'm talking about the salivary glands. They might give you external carotid artery, but most most times what happens is they give you numerous unnamed branches. They supply the artery, the gland in proper. So external carotid artery is the important one which you should remember and which you should answer when an examiner asks. But it gives various branches to the gland through which arterial supply is maintained. So coming to the nerve supply, through the parasympathetic, it causes secretomotor and so the parasympathetic through the auriculotemporal nerve, and the sympathetic is from the plexus around the middle meningeal artery. So coming to the parotid lymph nodes, they are always present superficial to the parotid, that is below the skin or just above the superficial layer of the deep investing layer of deep cervical fascia. So you can always palpate if there is a gross enlargement of the parotid gland. You can always palpate the lymph nodes. So these drain into the various neck lymph nodes. So there are 7 groups of lymph nodes in the neck. So most commonly they drain into the post-auricular group or the fifth group of lymph nodes, and fourth and fifth group of lymph nodes stations. So coming to the submandibular gland, it is located in the digestive. Compared to that, it is compared to the parotid, it is small in size. And when you see it in a cut section, it is roughly a J-shaped, inverted J. So again, it has superficial part and it has an inferior, medial, and lateral surfaces. So I'm not going extensively into the surface landmarks and surface anatomy. If if a question is asked about salivary glands in your exam, always write in brief about the anatomy. That is, you don't need to write the entire superficially it is situated here, superficially it is situated there. Those are all not that important, but the main thing you should always write is the blood supply, venous drainage, nerves, and the duct, about the duct. So again, the superficial layer is the inferiorly, it has the skin, platysma, cervical branch of facial nerve, facial vein, and submandibular lymph nodes are present. Mylohyoid, hypoglossus, and styloglossus muscles. So here you can see this is the medial. These are the muscles that are present medially. So like parotid, submandibular gland also has the superficial and deep part. So this is the superficial part. After a curvature, that is the inverted J, this is the deep part of the submandibular gland, which is sandwiched between the mylohyoid muscle. So that the submandibular gland is the Wharton's duct. It is also approximately about 5 centimeters long. So who will tell where does it open in the mouth? So ఇక్కడ already ఇచ్చేసినట్టుంది, sorry. So exact location. So always remember at the side of the tongue frenulum. So whenever you lift your tongue, just in the frenulum, you can see that ductal opening. The blood supply is the facial artery, and the vein is the common facial or lingual vein. Lymphatic vessels are the submandibular lymph nodes. Can anyone say in which group does the submandibular lymph nodes come under the neck nodes?
First group.
First is submental, I guess, and what? Submental and what?
Submandibular and submental.
Okay. What of the second group?
Two, three, four are upper, middle, and lower cervical nodes.
Okay.
I mean,
Again,
jugular.
two has yeah, upper, middle, and lower jugular. Yeah. So again, two is divided into 2A and 2B. So what is 2A? What is 2B? What are situated in, what are the boundaries of 2A and 2B?
Spinal accessory nerve.
Yeah. Spinal axillary nerve differentiates the 2A and 2B. So anteromedial is the 2A and posterolateral, posterolateral is the 2B. So the fifth level of also has level 5A and 5B. So just remember the levels of lymph nodes. Level 1 is the submental and submandibular nodes. Level 2 are the upper jugular. Level 3 are the middle jugular. Level 4 is the lower jugular. Level 5 is the posterior triangle nodes, which are again divided into 5A and 5B. And 5B, again 6 is the pretracheal or central group of lymph nodes. Level 6 is called as can be called as central group of lymph nodes. And there is level 7. What is level 7? Game mediastinal. Level 7 is the mediastinal group of lymph nodes, which are not accessible to palpate. So up to 6th group, you can always palpate the lymph nodes. Coming to nerve supply, through the secretomotor fibers from the submandibular ganglion, there is sensory fibers from lingual nerve and the vasomotor and sympathetic fibers from the facial plexus. Then comes the least common one, that is the sublingual gland. So sublingual gland has a multiple ducts. About 15 ducts emerge from this gland at different sites. They are the smallest of the salivary glands. They always open directly into the floor of the mouth. Coming to sublingual gland blood supply and nerve supply. So lingual artery and submental arteries supply the sublingual gland. Nerve supply similar to the submandibular gland. Coming to minor salivary gland, so they are situated entirely in covered at the oral cavity in the mucosal aspect. About 600 to 1000 are present in clusters. So they don't have a what do you call as storage capacity like the submandibular gland or gland or sublingual gland. They don't store any kind of secretions. So that's why stone formation is common in parotid. I mean the larger salivary glands, but most commonly stones are seen in which salivary gland of the three major salivary glands, which is most commonly a precursor for stone formation. Can anyone guess that? Parotida, sublingular, submandibular.
Parotid.
No, submandibular. Why? Because submandibular gland and its ductal drainage is anti-gravity. Always remember that, because the secretions whichever is produced by the submandibular gland should pass anti-gravity. So they should pump it upside into the floor of the mouth or the frenulum, behind near the frenulum. So stone, the most common pathogenesis of pathophysiology of any stone formation, be it in renal stones or gallbladder stones or any kind of stone, the main pathophysiology is stasis. So in parotid you don't have a question of stasis, but in submandibular gland, due to the anti-gravity phenomenon, there is always a chance for stasis. So in submandibular glands, the chances of developing a stone is common, more common. So minor salivary glands lo asla concept లేదు కాబట్టి there is no chance of developing a stone, because the gland itself is very small. So there is a continuous slow secretory activity. So one of the example of the minor salivary gland is the glands of Baldwin and Dunn. So they are located at the apex of the tongue. They are chiefly mucosecretory type. And glands of von Ebner, they are posterior. They are situated posterior aspect of the tongue. So these are the glands, and this is the duct of it, which can't be accessed or seen with the naked eye. These are exclusively serous type of discharging glands. So coming to the physiology part, about 1 liter of saliva is secreted from all these salivary glands, which constitutes about 90 to 98% or 90 to 95% water. So coming to the functions of the salivary gland, the main function is lubrication and facilitating for deglutition. So it lubricates the oral cavity, and it also helps in first primary what do you call breakdown of food particles in your mouth. So they also have a role in maintenance of tooth integrity, antibacterial activity, taste and digestion, etc. So can anyone say tell what are the components of a salivary gland? So, sorry, saliva. What is the composition of saliva? I heard only told you about water. Water కాకుండా ఇంకేమేమి ఉంటాయి? majorly. So, it constitutes lingual lipase. So lipase is produced by pancreas. So that is the digestive juice which helps in breakdown of the food. But in the tongue itself, in the mouth itself, lingual lipase is secreted by the saliva. So one of the most important one is the lingual lipase. It also contains traces of amylase and electrolytes like sodium, potassium, chloride, etc. They also has some proteins and enzymes like cystatins, and salivary peroxidase, etc. I don't remember the entire enzymes, but these are some of the enzymes that are present in the saliva. So all these constitute, along with the 90%, 90 to 95% of the water, all of these constitute the saliva. Through the stimulation of the parasympathetic nerves, this which liberates the calcinin. So this is mediated by the release of acetylcholine, and they also release the vasoactive intestinal peptide. So after all these effects, what's happening is the vasodilation of the salivary glands. So this increases the secretion of SNA, secretion from the SNA. So whenever you see or smell food, all these things happen without even your knowledge. So that is why whenever you are hungry, you smell something, there are always sometimes you can see you can elicit pain in your parotid region or in your submandibular region. Sometimes, not every time, because uh, that that impulse has created the constriction and release of saliva from your glands. This sometimes can cause mild pain. So here it is given. So salivary secretion increases either by taste of food. So once you taste it, in about 20 to 30 seconds, the salival secretion increases. But even without tasting it, by sight, smell, or thought of food, can cause a reflux and increase and production of the saliva. So best example is in Telugu states, ఏముంటది ఆవకాయ. సో మన తెలుగు వాళ్ళకి ఆవకాయ స్మెల్ చూడడం వెంటనే తినకుండానే ఫస్ట్ నోరు ఊరడం అంటారు కదా, దట్ ఈస్ ద కండిషన్ రిఫ్లెక్స్. So there are different factors which alter the salivary flow. So there are psychological factors, circadian rhythm, diurnal variation, age, drugs, and depression, dehydration, etc. And a dehydrated patient always has a decreased flow of saliva, because there is no water in the body to produce saliva. These are the different factors which alter the salivary flow. There are salivary gland diseases which also alter the salivary flow. Those are radiation silidinitis. Silidinitis is inflammation of salivary gland. The term is silidinitis. So there are autoimmune diseases, HIV infection, iron overload, sarcoidosis, amyloidosis. These are sarcoidosis, amyloidosis, and cystic fibrosis are inflammatory conditions, chronic inflammatory conditions, which leads to decreased salivary flow. So sympathomimetic drugs like adrenaline, ephedrine stimulate salivary secretion, and parasympathetic drugs like palacarpine Muscarine and phyostigmine increases secretion of saliva. And while these drugs increases the secretion, ergotamine, best example is ergotamine, abolishes the salivary secretion. So these drugs decrease the salivary secretion. And atropine and scopolamine inhibit the secretion of saliva. So there are certain factors which change the salivary composition. So that composition can be altered due to certain factors like flow rate, type of stimulus, diurnal variation, diet, and hormones. So mineralocorticoids and during ovulation, due to the hormonal fluctuations, the composition can change. And in the disease states like diabetes, hypertension, cystic fibrosis, and Sjogren syndrome, these also can cause to salivary composition altering. So that is the physiology and anatomical part, a brief and fast review. In the next class, I will discuss in detail about the diseases and most commonly occurring benign lesions of the parotid, and briefly about the carcinomas in the parotid gland. Now I'll also try to put in a video about the surgical part, where superficial parotidectomy and deep parotidectomy, how the surgery is done. So thank you.